Now continuing with the lecture of the bipolar disorders. So this slide we have already discussed in the previous lecture that what is the difference between schizophrenia and bipolar disorder. Now the common factors are the low level of the education, young age, cognitive impairment, high intensity of delusional symptoms, and suspiciousness, substance abuse, minority ethnicity, poor insight, poor therapeutic alliance, low socioeconomic status, and barriers to the treatment, bad patient experience of admission. Now, lifestyle changes, these are the changes to stop the cyclical behavior that may worsen bipolar disorder. These are the quit drinking, quit drug use, do not engage in unhealthy relationship, get regular physical activity and exercise, get plenty of sleep. Now, this is a slide showing that pharmacotherapy for bipolar disorder. This is lithium, then typical antipsychotics, anticonvulsants, and atypical antipsychotics. So you can see in this slide the year when they were discovered. Typical antipsychotics are the chlorpromazine, trifluperazine, fluphenazine, haloperidol. Atypical one are clozapine, olanzapine, risperidone, quetiapine, ziprasidone, and aripiprazole. Antiepileptics are the carbamazepine, valproate, lamotrigine, oxcarbazepine. Treatment is essential because patient can lose up to 9 years of life if not treated, can lose 14 years of effective activity, can lose 12 years of normal health. Many patients attempt suicide, around 25% of the patients attempt suicide, and 60% have substance abuse, comorbid substance abuse disorder. Hence, treatment is essential, only 1/3 patients are treated. Now, the pharmacological treatment are the mood stabilizers and antidepressants. Mood stabilizers are the lithium, anti-epileptic drugs like valproate, carbamazepine, lamotrigine, oxcarbazepine. Newer antipsychotics, risperidone, olanzapine, ziprasidone, aripiprazole, quetiapine. Antidepressants like SSRIs, venlafaxine, bupropion. Then this slide showing same. They are classified into traditional and newer. Now here the pharmacological therapy, mood stabilizing drugs are the first choice of drugs for the treatment, and they are the lithium, sodium valproate, carbamazepine, lamotrigine. Clozapine and atypical antipsychotics are also approved for the treatment of the acute mania. Lithium, lamotrigine, olanzapine, aripiprazole are approved for the maintenance therapy, benzodiazepine for the acute mania. Antidepressants used for bipolar depression if it is accompanied with depression, but usually with a mood stabilizer agent to prevent mood switch. So the mood stabilizing drugs, that is the lithium, sodium valproate, carbamazepine, lamotrigine, are the primary pharmacotherapy and they are also useful for relapse prevention. Drugs used as mood stabilizers are the lithium valproate, carbamazepine, olanzapine, haloperidol, lamotrigine, asenapine. Now in treating bipolar disorder, you can see that patient should the doctor should avoid sedation, minimize metabolic side effects like weight gain, blood pressure, hypertension should not be there, triglyceride, lipid and blood fasting level should be normal, blood glucose level should be normal, and monitor the metabolic risk factors every 3 months. Now this chart shows the various drugs for the treatment of the bipolar disorder. Aripiprazole approved for acute mania and for prevention of manic recurrence. Quetiapine, acute mania, acute depression and prevention of the depressive recurrence. Ziprasidone for acute mania, prevention of depressive recurrence, prevention of manic recurrence. Carbamazepine for acute mania, risperidone for acute mania, lamotrigine for prevention of depressive recurrence, prevention of manic recurrence, valproate for acute mania, lithium for acute mania and prevention of depressive recurrence, prevention of manic recurrence. Asenapine for acute mania. This chart shows the psychopharmacology algorithm project at the Harvard South Shore program. Update on bipolar depression. Recommended medication for acute bipolar depression: lamotrigine, lithium, quetiapine. Options after first line medication trials are antidepressants and valproate. Role of antidepressant: they are useful in bipolar 2 disorder when there is depression. Medication not considered are the olanzapine and fluoxetine. FDA approved agent for bipolar disorder. For acute mania: lithium, chlorpromazine, divalproex, olanzapine, risperidone, quetiapine, ziprasidone, aripiprazole, carbamazepine, asenapine. For acute depression: olanzapine plus fluoxetine, quetiapine. For long-term use, that is for prophylactic maintenance therapy: lithium, lamotrigine, olanzapine, aripiprazole, quetiapine, risperidone, ziprasidone. Main polarity benefit of maintenance treatment for the bipolar disorder. Lithium for mania, all these drugs can be used like lithium, aripiprazole, olanzapine, quetiapine, risperidone, ziprasidone. For depression, only quetiapine can be used as well as lamotrigine and as well as lithium. So these are the drugs used to treat the bipolar disorders. Now this slide shows the medications commonly used for bipolar disorder. So lithium is used for acute mania. Mixed episodes. So for acute mania, acute depression, as well as can be used for monotherapy or in combination with other agent. Valproate for acute mania, acute depression. Carbamazepine also for acute mania, acute depression. Second generation antipsychotics, acute mania, acute depression. Lamotrigine also acute mania, acute depression. Now coming to the mood stabilizer. A mood stabilizer is a psychiatric drug used to treat mood disorders characterized by intense and sustained mood shift, typically bipolar disorder type 1 and type 2. Mood stabilizers are licensed as part of long-term treatment for bipolar disorder, for mania, for recurrent severe depression, and also for schizophrenia. Lithium comes under the category. Lithium is the classic mood stabilizer. Lithium is under the category of mineral. It is a classic mood stabilizer. It is the first drug to be approved by the US FDA and it is still popular in treatment. The therapeutic drug monitoring is required for lithium and it is a drug of narrow therapeutic index. Therapeutic range of lithium is 0.6 to 0.8 milliequivalent per liter. Now the precise mechanism of action is not known and it is suspected that it acts at various points of the neuron. Lithium is known to inhibit the enzyme GSK3B. This has the effect relieving pressure on the circadian clock, which is often malfunctioning in people with the bipolar disorder. And it also positively modulates gene transcription of brain-derived neurotrophic factor. The resulting increase in neural plasticity may be responsible for the lithium's therapeutic effect. So the main action is to inhibit the enzyme GSK3B, and this leads to the relieving the pressure on the circadian clock, which is malfunctioning in the people with bipolar disorder, and this also modulates gene transcription of the BDNF factor. And lithium may also increase the synthesis of the serotonin. Another mechanism is that lithium inhibits the enzyme inositol monophosphatase and inhibits the conversion of inositol triphosphate to inositol. leading to depletion of the phosphatidyl inositol biphosphate PIP2. This results in a reduction in the formation of the second messenger IP3 and diacylglycerol. That is, inositol triphosphate and diacylglycerol are not formed, leading to the reduction in the, so once second messengers are not formed, that leads to a reduction in the receptor activity. So lithium selectively inhibits signal transduction in the hyperfunctioning neurons as seen in the mania, and inhibits the monophosphatase that converts the inositol phosphate to the inositol. So it selectively inhibits signal transduction in the hyperfunctioning neuron which is seen in the mania. And it also relieves pressure on the circadian clock, which is malfunctioning people with bipolar disorder, and positively modulates gene transcription. The resulting increase in neural plasticity may be central to the lithium's therapeutic effect. Now, lithium is indicated in bipolar disorder. Normal levels are the 0.6 to 1 milliequivalent per liter. Toxicity occurs above 1 milliequivalent per liter. Mild toxicity up to 1.5, moderate 1.6 to 2.5, greater than 2.5 is a severe toxicity. Toxicity symptoms are tremors, slurred speech, confusion, drowsiness, vomiting, reduced renal function, and convulsions. Side effects are the common side effects are the polydipsia, polyuria, weight gain. Common drug interactions are with the non-steroidal anti-inflammatory drug, AC inhibitors, angiotensin receptor blockers, and diuretics. All these drugs increase the serum lithium level. Now coming to the therapy for the bipolar illness for hypomania, lithium or valproate or carbamazepine. If no response, then add a anti-epileptic drug or a atypical neuroleptic. Mania, lithium or valproate plus lorazepam. Severe mania, if no response, plus a anti-epileptic plus a atypical neuroleptic. Then mild depression, lithium or lamotrigine. Severe bipolar depression, lithium plus SSRI. If response inadequate, lithium plus SSRI plus lamotrigine. Now this slide shows the FDA approved drugs for mania and maintenance therapy in bipolar disorder. So in acute mania, aripiprazole, carbamazepine, chlorpromazine, valproate, lithium, olanzapine, quetiapine, risperidone, and ziprasidone. Then for maintenance therapy, aripiprazole, lithium, valproate, lamotrigine. Quetiapine is useful for acute phase of both bipolar mania and bipolar depression, but not for the maintenance phase. Anticonvulsants for bipolar disorders, valproate, lamotrigine, carbamazepine. They are used as mood stabilizers. Mechanism of action are uncertain. Inhibition of adenyl cyclase, reduction of inositol generation, and activation of neuroprotective genes. Therapeutic uses are as monotherapy in acute mania, as a monotherapy in acute bipolar depression, and as maintenance therapy. So they can be used as in acute mania, acute bipolar depression, and as a maintenance therapy. So this chart shows the adverse effects and the drug interaction of the various drugs. Lithium, weight gain, sedation, rash, tremors, hypothyroidism, polyuria, low margin of safety. Monitoring is required every 3 to 4 days. 90% is eliminated through the kidneys. Drug interactions with the diuretics, indomethacin, then AC inhibitors, non-steroidal anti-inflammatory drugs, COX-2 inhibitors, phenytoin. The other drugs you have already studied in the respective lectures. Now for acute treatment and maintenance treatment. For mania, lithium valproate, olanzapine, risperidone, quetiapine. For depression, lithium, lamotrigine, fluoxetine, olanzapine. For maintenance treatment, lithium, lamotrigine and olanzapine. So mood stabilizers and atypical antipsychotics and antidepressants are given for the bipolar illness. Mood stabilizer reduce acute symptoms, stabilize mood swings by influencing the neurotransmitter. Atypical antipsychotic block the receptors in dopamine pathway. Antidepressant relieve the symptoms of depression. These are the medication for bipolar disorder. Second generation antipsychotics: aripiprazole, olanzapine, quetiapine, risperidone and ziprasidone. Now this slide shows that there is no actual cure for bipolar disease, but various treatments and medications, the people of bipolar disease can live a normal life. These are just a few of the treatments for bipolar disease. This is the mood stabilizers which delay and relieve episodes of depression and mania. Antidepressant work with mood stabilizer and slow depression. Antipsychotic help treat mania and also severe cases of depression. ECT is useful to treat mania and depression, severe episodes of mania and depression. Psychotherapy or talk therapy, also known as psychotherapy, can help people with bipolar disease sense of their thoughts and feelings. Through talk therapy, people can get valuable advice and support, regain their confidence and reduce any stress they may have. Self-care is important. Learning about bipolar disease is first critical step in self-care. Tracking and recording the mood is also helpful. Avoid things that trigger the depression or mania and join a mental illness support group that can help lessen the stress of having the bipolar disease. So with this we end today's class. Thank you.